So we, as you know, have had the current beds within the organisation for 15 to 20 years, and some of them were becoming, well, they're all old, and some of them were out of service and not really fit for the purpose we wanted for our patients and for our staff as well. We had entered into procurement for the new build and had a plan to bring new beds into the new build, and we saw an opportunity to bring them onto this build. So you will have noticed that we've had beds delivered over the past few weeks in the organisation. We've currently got about 500 out of the 800 that we need on site. And that programme is continuing. These new beds are more reliable because they are newer, they're fit for purpose. We went out for work in procurement with the organisations and had our users with us, our staff with us, to make sure that we were getting beds that worked for staff, patients and for the people of Merseyside for the future. So it's a really exciting time for us.
So the best part about rolling out these new bed frames in the Trust is that it's going to improve patient safety. They are all low profile in beds and they all have 4-bar side rails, which means any mattress we use within the Trust can go on the one bed frame, which again improves patient safety and time and efficiency in getting the patients onto the bed frames and the appropriate mattress.
Staff training started actually well over 2 months ago now, so back in April it started, but as you say, it's still ongoing because obviously we want to make sure that we've captured everyone in the organisation and we've got the opportunity to. So there are training videos out there, and the staff are willing to come and train on the job as well when the beds are actually put out onto the wards, and we can dip into this training at any time that we need to. So anyone that feels they need the support, they can actually get it at any time.
Well, when the plans were first made to replace all the mattresses in the Trust, my initial thoughts were, what's going to happen to the old mattresses? Surely there's people out there who can make better use of them. So we decided to contact the International Aid Trust, who we already do a lot of work with, to see if they had countries who could make better use of the mattresses. So far, over 200 mattresses have been sent to countries like Uganda, the Ukraine, Romania, and they're making excellent use of our old mattresses in the hospitals.
We can say this is something we're using the money for correctly within the Trust. So it's the best use of money for the organisation is what I'd say. So again, great for the Trust, isn't it? But brilliant for those patients out there that are going to use the old beds as well.